Good afternoon. Good afternoon. I would like to thank the Academy for developing this wonderful field of aesthetic medicine that we all enjoy. It is really a part of anti-aging. And how many people in the audience are currently practicing aesthetic medicine with their anti-aging practices? Okay, so about half of you. Good. You'll find as when you develop skill in keeping your patients healthy and helping them achieve optimal health and longevity, that they're going to want you to also be able to help them look the way that they feel. And that's really what brought me to aesthetic medicine, was that I got to a point where I felt like I had a pretty good skill set in anti-aging medicine, and I really truly enjoy creating health in my patients, and then they really wanted their exterior appearance to match how they were feeling physiologically. So there's a great synergy between the two fields, and that caused us to develop the aesthetic division of the American Academy of Anti-Aging Medicine, and also the Aesthetic Fellowship. Now, the Aesthetic Fellowship is the first of its kind in the world, and it is created to help establish best practice standards for evidence-based medicine in aesthetics. This is very important for our field because currently there's a lot of commercial influence, and we would like really to establish scientific evidence-based practices for our patients, because aesthetic medicine is medicine. So it's my task this afternoon to give you an update about what is occurring, and it's challenging because this field is just exploding. I mean, there are things being developed as we're sitting here enjoying our academy. So I will go through the things that I know, and I will tell you that we'll have to do this at each conference because truly the development in this field is part of what makes it exciting and attractive. So let's start with Botox, because Botox really is what gave us the field of aesthetic medicine. As soon as we were able to relax the facial muscles so that we could have a relaxed, youthful appearance, then it made sense to use the fillers and the laser procedures to get rejuvenation of the face. So let's start with what's going on in Botox. As we all know, that currently we have one in the United States manufacturer of botulinum toxin, and that's produced by Allergan. And they have enjoyed a monopoly for some time now. And that has, I think, we have enjoyed a good working relationship with Allergan. They've done a lot of scientific research, but we've been limited with just one product. So the news is that over the next year, we're going to have many new botulinum toxin types A entering the marketplace. So our sales in botulinum toxin are going to increase 17% per year to a $1.6 billion industry. And that's even taking into consideration the softening of our economy. Botox cosmetic sales are going to increase 12% through 2010. Allergan has strong brand recognition, it has trust in the community, it's done some really great job at direct-to-consumer marketing, and it has high patient satisfaction. We as practitioners are stuck kind of with a very high price point because Allergan has had a monopoly. Relaxin is going to be released, I think, in January of 2009, so imminently. And so Relaxin will take part of the market share from Allergan, and its sales are predicted to go from 8.1% to 12% in 2010. So again, this product is different than the product that we are currently using through Allergan, and it will require different injection techniques. It diffuses differently, and so we have to inject it differently to get the same excellent patient outcomes. So it will require additional training in order to utilize this product in your patients. These are not equivalent for dosing, and they behave differently physiologically in patients. And this is primarily due to the protein content, or the non-toxic protein content in the substance. The less protein, the more that the toxin will diffuse. And so as we get more toxins that come out, the big difference is going to be how much protein is complex to the botulinum toxin. And Relaxin has about half as much protein as the compound from Allergan, and so it diffuses about twice as far. So that will impact where you place your injections so that you can perform them safely. There's another toxin coming out by Mentor. It's going to be called Pure Tox, and it is expected to come out in late 2009. It's extensively purified and, again, will have the lowest protein content for the next year. And then Merce will come out with their product, and it will be another botulinum toxin type A. And this is claiming to have no protein. And so this will have pretty dramatic effects on the diffusion, which we don't fully appreciate yet. So again, the news is, as we get these new products, hopefully we'll have a little bit better pricing, and we'll be able to offer these procedures to our patients at a more affordable rate. But all of these toxins are different. They'll behave biologically differently, and so we'll have to gain experience with both dose ranging and injection technique. Now here's an interesting development. There is a topical botulinum toxin that's being developed, and I am not really sure how that's going to work out. I mean, it seems as if that may or may not be a particularly good idea, but I think it's interesting that the technology that it's called macromolecular transport system is purported to be able to drive this 150 kilodalton protein down into the muscles where it's exert its effect.